If you have decided that CPAP is not for you at the moment, or maybe you're doing the trial and you're like, you know what, I'm gonna hold off. Well, this video is for you. In this video, I'll show you a couple tips if you decide to hold off on CPAP on how to sleep better without the machine. Now, ultimately, CPAP is one of the most effective form to treat your sleep apnea. But if you decide you want to hold off, well, I have a couple tips for you in this video. My name is Harlan, a registered respiratory therapist, and I help thousands of patients who suffered from sleep apnea. I myself used to wake up frequently in the middle of the night, gasping for air. I would wake up feeling tired and groggy. If you put me in the back seat of a car, I would fall asleep right away. But now, after being treated for sleep apnea, my sleep has been amazing. Wake up feeling refreshed, more energized, less groggy. But this video, I want to give you some tips. If you decided that you do not want to use the machine temporarily, there's no judgment to it. I get it. Sometimes it's not the right timing. Even for myself, when I first got diagnosed with sleep apnea, I did not take the machine. And I continued sleeping the way I've been sleeping, suffering from sleep apnea, until finally I got the machine myself and decided to use it, and my life has changed dramatically. And quite frankly, you can't force anyone to use the CPAP machine, same as you can't force anyone to go to the gym. They have to actually want it themselves. So if you decide that sleep apnea is not for you at the moment, here are two tips. Number one, stop sleeping with two pillows behind your head. Why using two pillows is not a good idea. Those of you who are CPR certified or CPR trained, remember in class what they taught you? Head tilt, chin lift. You lift the chin up, tilt the head, so that your airways can be clear, so you can breathe. But if you put your head down this way, like you're having two pillows, you can't do CPR like this because the airway is kinked, kind of like a hose that's kinked. That water is not flowing. Those people who have GERD or heartburn, their doctor may tell you to elevate your head when you're sleeping. They want you to put a wedge, kind of like a triangle, like a wedge pillow behind your back of your back and part of your neck. That's different from putting a pillow behind your neck like this. Some people, they may start off elevated with a wedge, but they may slide down until their head is tilted like that. Because when your head is tilted like this, I can barely breathe like that. You're just choking yourself. You're making your sleep apnea even worse. Second part, thinking of getting treated, or you're putting a pause to your treatment so that you can get treated later in the future. I just want to make that really clear because I don't want you to think this is an alternative to CPAP. But we know that CPAP is the most effective way to treat your sleep apnea. Don't use two pillows, just use one. And number two, try to sleep on your side instead of your back. And I hear this from many of my patients, is that when they sleep on their back, it's harder for them to breathe. You have all this tissue, this weight that collapses your airways. Gravity just compresses against that airway. When you sleep on your side, your tongue will fall sideways and nothing's impacting that airway. This is not a guarantee that this will fix your sleep apnea. This can relieve some of it when you're sleeping on your side. Of course, when you're trying to sleep on your side, you may accidentally turn back to your back and then you're gonna have sleep apnea. That's why we want CPAP to be the main treatment. When you're using your CPAP machine, you can sleep any way you want. Your back, your side, and even on your stomach, depending on what mask you're using. Now, I told you many times before, I use the Dreamwear that goes on top of your head. You can sleep, do a 360 in bed, and you're still okay. If you're not using your CPAP temporarily, or you're thinking of it and you want an alternative to fill that gap, don't use two pillows and sleep on your side if you can. In our next video, I want to talk about two myths, two urban legends of sleep. The first one is nasal strips. Do they help? Or who can benefit from that? And also mouth tape. That's been the buzz. Does mouth tape work? Sleep apnea is a process. In the beginning, it can be tough, and I help thousands of patients go through this. Patients that have given up on CPAP and came back years later and decide to pick that machine back up. Don't give up, and I'll see you next video. Cheers.